Hello, I'm Dr. Vivek Sukumar, Consultant Surgical Oncologist working at the Specialty Surgical Oncology Hospital and Research Center. I specialize in GI oncology with particular interest in colorectal oncology. Today we are going to discuss on a topic which is one of the most important questions that patients as well as their attenders ask us when they come to our OPD as to what is going to be the treatment of the cancer that they're suffering from and what is our approach going to be. So to treat any cancer, there are generally 4 stages in which we interact with the patients and we make certain decisions. First is based on the presentation in which the patient comes to us and the different problems that they have are elicited to us, and based on that we decide on how to move on further. A first phase of treatment is the workup. The workup includes a general imaging which helps to determine what is the stage of the disease. Second is a tissue-directed biopsy, which helps us determine what the type of tumor is. And third is a general workup of the patient to determine the fitness and also what kind of treatment we can offer him based on the parameters which we find. After this, we get a particular staging of which the cancer has presented. The stages can vary from stage 1 to stage 4. Stage 1 being the earliest presentation and stage 4 being the latest presentation. Now the treatment of cancer would depend at the stage at which the patient presents. Generally, in early stages, the cancers are completely treatable and generally only one modality of treatment may be required. Whereas as the stage advances, the type of treatment that we give may be multimodal, meaning we might have to add surgery and chemotherapy as well as radiotherapy in these patients to achieve optimum results. For example, if a patient presents to us with a locally advanced or stage 3 rectal cancer, we would need to first give chemoradiation, following which we reassess with an MRI, then perform a surgery, and based on the biopsy after the surgery, we might need to give even further chemotherapy. Whereas if the same patient had presented to us in a very early stage or a polypoidal stage or stage 1, we might be able to get away with only a surgery. Now, the different treatment modalities of cancer are surgery, which is one of the gold standards of treating cancer when we discuss solid tumors. Second is chemotherapy, and third is radiotherapy, both of which are essential to achieve optimal outcomes depending on the stage of the disease. Newer modalities are being added to chemotherapy such as immunotherapy, which helps improve the outcomes. It is important to remember, once we complete treatment of cancer, we don't stop once the treatment is completed at this particular event or this particular stage. We keep monitoring the patient for over a period of time with a more aggressive monitoring in the initial 2 years, following which we continue monitoring him for another 3 years and extendable up to 10 years after the definitive treatment is given to ensure that there is no recurrence. So the treatment of cancer, as I mentioned earlier, would be divided into 4 stages. First, the workup with which the patient presents to us. Second is the definitive diagnosis after the biopsy. Third is the definitive treatment that we give. And fourth is the follow-up after the definitive treatment. If you have any queries or comments regarding this video, please do write to us in the comment box. Thank you.